Hi, students. Hi, I wanted to put a lecturette together for you. A couple of students have contacted me about all of these vitamins and minerals and felt a little overwhelmed. So I wanted to do a little lecturette that would talk about the vitamins to kind of help you out a little bit. So we're going to be talking about the fat soluble, the water soluble, the trace minerals, and the major minerals as well. So with that being said, I want to jump right in. We're probably going to do two different sections. I'll handle fat soluble and water soluble together, and then we'll put the minerals in their own lecturette as well. So I'm hoping this won't be too long, but I do think it needs to be a little lengthy so that you can get the gist of this. But so what I'm going to do now is go ahead and just talk a little bit about what are vitamins. We've talked about vitamins before in class, but according to the textbook, they're tasteless organic compounds, and they are required in usually small amounts. Now, the reason for them is that they have functions that are very important to our body. And we've talked about this before in regards to vitamins won't help you gain more energy. However, if you're lacking a vitamin that is used in the process to make ATP, then it might as far as metabolism goes. So it helps to regulate metabolism, these vitamins, and they help convert those macronutrients. So remember, carbohydrates, proteins, and fats, we need the vitamins sometimes to do the work to get where we need to go. So vitamins are extremely important. And when we look at vitamins, there's a couple things that we like to look at is A, what is their function? And B, what foods they have in them? And C, what are their consequences if we have a deficiency? And then also if we have an abundance or we take in too much. We've talked many times about how Americans like to take a pill to cure things. And so sometimes people will take vitamins when they're not necessarily necessary. And sometimes they can actually be harmful. So we're going to talk about what we call the upper tolerable intake limits, or the ULs. And this kind of coincides with your assignment that you have where you're doing your Canva, and you're going to come up with an infographic that's talking to me about your vitamins and minerals. So I want to kind of just go in and delve a little bit deeper into these vitamins. Now, what I'm going to do is move this over just a little bit, get it here, go down. Okay, see if I can move them back. Okay, there we go. So hopefully that'll help me. When I put it in full slide view, it doesn't move appropriately for me in Zoom. So vitamins are a newer area that when we look at, like, as far as science goes, dietetics and nutrition is an evolving field, and we've said this many times. And so vitamins really have only been discovered over the last 100 years. And so we've looked at some of those discoveries. We looked at vitamin D. We're going to talk a little bit about vitamin C as well. So I'll let you guys do that, but this is a good visual for you to think about, and that is the difference between the fat soluble and the water soluble, and I do want you to know the difference. So for the purposes of the exam, we're going to put them into areas where we have 9 water soluble vitamins and then 4 fat soluble vitamins. So when we look at that, the easiest way to remember to me is to remember the fat soluble, and if they're not fat, then they're water. So in that case, it's A, D, E, and K. So A, D, E, and K are going to be your fat soluble, and if you look at the image here, what we're looking at is a fat soluble, or what this looks like, olive oil. And then this is symbolic as well, because we're going to talk about how fat-soluble vitamins stay in our body, whereas water-soluble vitamins don't. So remember how when we looked at any of the macronutrients, whether it's carbohydrate, protein, or fat, we were kind of comparing and contrasting them. Well, I'm going to ask that you do the same thing with these vitamins and minerals in regards to even just knowing the 2 different groups and saying, okay, if they're fat soluble, what are their traits? If they're water soluble, what are their traits? So we're going to just delve into that a little bit as well. Okay, so this is a good slide for you to just not memorize, but to review. It just kind of helps you alleviate, like when you're working on your diet analysis project or your Canva project, this helps you decide, what vitamins are going to play what roles in the function that they have. And so this is important for studying for the exam, as well as trying to say, for example, if you happen to be low in vitamin D, when we look here, vitamin D is here because it's looking at growth and reproduction. My pointer's not moving very well. And then also for bone health. So these are going to be areas where if you're low in those, that you're going to need to tell me that because I'm low in those, then I may not have the growth and reproduction of cells in my body as fast as I need, which could then lead to what? And then same thing with the bone health. If I don't have good bone health going on now at my age, what does that mean later on in life? So those are just ways for you to start thinking about these things. And then of course, here's also vitamin D right now with immune function. So if we're talking about immune function, along with everything that's going on with COVID, is it important to, have a strong immune system? Absolutely, whether it's COVID or not. So these are things I want you to tell me. So how do you get more vitamin D in your diet? That's what you want to tell me. And then what are the food sources of how you're going to be able to do that for me? Okay, so how do they differ? So we're going to talk a little bit about fat soluble and water. I'm skipping a few of these slides. What I want to get into is, we've talked about this before, so I don't need to spend a lot of time, but antioxidants, remember the antioxidants, those are the free radical formations that we have in our body, and the antioxidants go in and help take out that oxidative stress, right? So you want to have antioxidants in your diet to help with free radicals. We talked about different ways stress can cause free radicals. So right now, because everybody's stressed a little bit more of their situation and the new normal, and change is hard, and there's a lot of things going on with a lot of families, and this is a scary time, and so stress raises that, right? So we have more oxidative stress right now, which means we have more free radicals. So it's all the more reason to keep our bodies healthy during this time, and getting foods that are higher in antioxidants are going to be helpful in the long term, because this is a nutrition and health class. Obviously looking at the #1 killers among Americans, and when you look here on your screen, look at the ones: heart disease, cancer was on that list, right? Diabetes was on that list. So take a look at these things and understand that it's important. Also, for anybody that's vaping or smoking, that when we do that, we definitely have more free radical production in our body. Okay, now this one I think is kind of interesting. Obviously, we're not going to do the reef question, but I want you to see this, and I want you guys to look at this for a minute. So the slide A is normal vision, but slide B has a distortion. And so what I was asking you is, which vitamin might cause this? So when we look at this, what would cause somebody to have this like gaping hole or like a long strip in their vision cycle screen that this would happen to? And this truly happens. So what might it be? So do you think it's beta carotene? Do you think it's vitamin E? Do you think it's just free radical damage? Or is it all of the above? Or maybe none of these cause this? So when we look at this, here's what I want you to see, is that there's a couple things. First of all, blurry vision like this is called cataracts. And so antioxidants definitely can play a role in who becomes more of a candidate for getting cataracts, and especially earlier on. And there are people that can keep it off. And what we know is the people that keep it off, they have a diet that's high in vitamin C and E. So this becomes extremely important in how we maintain eye health for our body. So that was the antioxidant for cataracts, but that wasn't what I showed you in the picture. What did I show you in the picture? Where did I? Well, I didn't have it there, but that means that it is this one here, which is age-related macular degeneration. So when we go back to this right here, when we look at this is called AMD, age-related macular degeneration. And what do you think it's a lack of? So it has free radical damage, and it's also because they have less vitamin C and E and beta carotene. So what's important when you go back and look at your diet is that right now your vision is probably okay. But if you were low in vitamin C, if you were low in vitamin E, or when you look at that, vitamin A is where the beta carotene is found. And so if you go back and look at vitamin A and it breaks down your beta carotene and it shows you were low in beta carotene, then that tells me that you're at higher risk for age-related macular degeneration later on in life. And that's what you're going to want to tell me on your Canva assignment and part of this diet analysis part 5 that we look at. So hopefully this chapter just kind of gives you like an aha moment of what the role of each vitamin and mineral is and how important they are to your body. And then of course, where can you find them if you are lacking them? Because most of you are going to be lacking them. we don't really have good diets. Okay, we've showed you this before. I've showed you this before in other chapters, so I'm just gonna kind of skip it for now. What I wanna get into is, oh, this is a good one for some of you when you are trying to find the foods that you're interested in, if you were low in a specific area. So for example, like if people don't like to eat vegetables, these are probably the ones that they're low in. So then it goes back to saying, okay, well, where else could I find some of these things in some of the foods that I might be willing to eat that were in the vegetable section. But so this is just a way for you to kind of help. And this is a my plate diagram. Okay, so this is about how vitamins can be destroyed during the cooking process. I'm going to go ahead and let you review that. There is probably a couple test questions on that, so stay with it. But what I want to do now is just go through, and this is a good way to study, and to look at, when you have to break these things down for your Canva or for your diet analysis report, that you take a look. Here's got the vitamin, so it's the name of the vitamin. What does it actually do for my body? How much do I actually need? What are the food sources? And then what are the symptoms for either toxicity or for deficiency? So every single vitamin, if you're looking at a way to study, this is a perfect way to study. So this chart is in there already put together for you. You can study from that. But we're gonna go through and look at these A, D, E, and K now, okay? So let's go through. So metabolic functions of vitamin A. So what is it helping with? So when we use vitamin A and we talk about its function, one of the things that most people know that it's good for is for their vision. And that's why we always used to say, if you eat a lot of carrots, that it helps you with your vision. This is why, okay? So vitamin A is very important in your vision. It's also important for protein synthesis and cell differentiation. So when we're talking about protein breakdown and we're talking about all these things that protein for a bodybuilder who's interested in, bulking up, something like that, we need to look also at their vitamin A. So it's not just always about the protein. It helps with the reproduction. It also helps with bone health and our immune system. So are those things important to any of you right now? So I want you to be thinking about that. If you want to increase your immunity, or if you have a loved one that you're very worried for this COVID and you want to increase their immune system, you want to make sure that they're having sources of vitamin A in their diet. And then of course, long term, one of the things that we know is that these carotenoids, which are the beta carotene kind of precursors in vitamin A, that they're very, very good at being antioxidants against cancer. So this is very helpful. And I don't know, this COVID thing is very, very new, but as far as the dietetics world is concerned, I think that we'd like to probably do some real interesting studies and saying, the people that are recovering, was their diet any different than the people that weren't? I mean, these are just things as a dietitian that I'm kind of interested in, but right now, obviously, we just need to, get the disease under control. But I think that these are things that might come out of it later, hopefully. Okay, so there is a video that I will have up inside of the slide area for you. That's an animation video about how important vitamin A is for your retinol role in vision and actually night vision specifically. So if people are having a hard time with night vision, one of the things that we look at is vitamin A. Okay, and then this is talking about how important vitamin A is with the epithelial tissue. And again, this video I really like because to me right now it plays home with how important vitamin A is with our mucosa, specifically with our nose and our epithelial cells in our nose. And so if we're talking about this COVID and we're talking about ways in which it's going to enter, one of the ways in which it would enter would be airborne through your nose or your mouth. And so having this really healthy epithelial area to just block all of that stuff out is how it really helps with your immune system. And so I think that this is kind of interesting. So I'll have an animation video up there for you. So how much does one need? Well, males and females are a little different on their needs. So males need 900 micrograms and females need 700 micrograms. And there's different ways on your report if you're going to be looking at this. So at some point you want to get your report out and you want to look at this, and there is something called Retinol Equivalencies, the RAE. So you want to make sure that you're reading the right one. And then there's also underneath that, there's going to be a beta carotene, and then there might be one other report. So just one other area inside of vitamin A. So you want to make sure you're reading the right ones. And if you're very nervous or don't know, then you can also go to my example that I have with the Canva that shows you the one that I want you to use. So What I also want to say is that if we do have someone who is adopted a vegan type of diet, that strict vegetarians usually have to get their vitamin A through the carotenoids and the beta carotene rich foods, because a lot of, if they're not coming from this plant-based, then they come from other areas where protein typically happens, although again, most of you are not eating liver. But we do want to, you know, kind of take a look at this. And how do we know which ones are going to have beta carotene? The ones that are bright orange, okay, bright orange or yellows have a lot of beta carotene. So cantaloupe is going to have a lot of beta carotene. Is it on there? Let's see. Yep, cantaloupe's on there, and you see how much higher it is. And then you see how pumpkin and sweet potato, those are all orange, just like carrots are. So bright orange and bright yellow things are going to be good sources for this one. Okay, now, can I have too much? That's the other part that I want everybody, when you're studying, is what's too much, right? And so there are things that you can have with toxicity to vitamin A. And one of the things when we look at the vitamins, the fat-soluble versus the water-soluble vitamins, is because fat-soluble stay in your system longer because they're stored in the tissue of your fat, then that can be problematic from a perspective of it building up and getting toxic. So we do have to be careful with that. And vitamin A, you can have hypervitaminosis. Remember hyper, what does that mean? That means high, and then the vitamin, and then osis. So we'll think about what osis means. So this one can actually lead to, if we have this, liver damage and possibly death. So we don't want to overconsume vitamin A. So that's the other thing I get worried, because the vitamin industry is not regulated. And we've talked about this a couple times, but they're considered a supplement. So if they're not regulated by the FDA, and you have a company that's putting out very high potent vitamin A, and it can be problematic, especially if the label says take one and the person takes two. And right now, I mean, when you think about, you know, there are some things in the media right now talking about people that were worried about COVID and took these experimental drugs, but they were, you know, like they bought them from the aquarium place because that's where they knew they could get it, because they put it in the water for the algae or whatever. And so they took it and they've passed away. The same thing happens when we look at this. So I get very nervous about, you know, if people hear, oh gosh, well this, you know, vitamin A is going to help with my immune system for COVID, and they take away a lot of supplements that have this, can it be problematic? And so the answer is yes. So you don't want to take too much. Now, I will tell you this. When you typically eat something, that it's usually very safe. It's the supplements that we're worried about. So in this case, because we looked at vitamin A and we actually looked at in the beta carotene form, remember, and we were saying how good the beta carotene form is. It is, and it is not toxic in our food. So when we look at carotenoids or beta carotene, it is not toxic in our food. But the supplements that we take are not in the same realm. They're not usually carotenoids, because the carotenoids cost more. So they put in a synthetic vitamin A supplement that can actually be a little bit more problematic for consuming. So take that in mind, that if you just ate a boatload of carrots, and I mean a boatload of carrots, the only thing that would happen was that you would turn orange. So it is not toxic, but you will turn orange. Your skin will get an orange pigmentation to it because the body is just overwhelmed with the amount of beta carotene in it. So if you want to be a pumpkin for next Halloween, hey, all you got to do is eat a bunch of carrots. I hope I made you laugh. I miss making you guys laugh because that also makes me laugh when you guys laugh, or makes me smile anyways. Okay, so now what are we looking at next? So deficiency problems. So I mentioned night blindness before. So if you have something where you have prolonged deficiency in vitamin A, you definitely can have night blindness. So right here, when you're looking at someone who has normal vision, the things that they can see in the night, whereas someone who has night blindness really can't see that same thing. And so this is a lot of times why you talk about, you hear your grandparents say they don't like to drive after dark. This is probably why. And actually this is preventable. This isn't something that just happens naturally. They can prevent this. This means that over time our diets are not strong in this particular area and we need to get it higher. So keep that in mind. All right, now the sunshine vitamin. What is that one? We've talked about it before many times, right? Because this is the one we've learned about rickets, right? And so we call vitamin D the sunshine vitamin. And that is because it definitely helps with Once you get it, it's going to help with bone formation, but where do we typically get it? And that's the sunshine. And seriously, because when you start to look at the foods, there aren't that many foods that actually have vitamin D in them. So we get a lot more of this from the sun. But there's still things that we need to be aware of for people that either have darker skin or are not out in the sun, or that are wear sunscreen or things like that. So we got to kind of look at how do these people get more vitamin D in their diet. Okay. So here's the chemical structure of vitamin D. I'm not going to talk about the fact if you go back here, it's actually a prohormone. So what does pro mean for? So it's a 4 hormone. That's why you see milk that says, that it's got calcium with vitamin D. It's the pro part that needs to help with the calcium absorption. So, and this process for absorption actually being absorbed into our body. So this is kind of, for those of you that want to be more of the science related folks that are going to delve a little bit deeper, I would take a look at these slides, but for the most of you, I'm just going to go ahead and skip over it to kind of talk a little bit more about vitamin D and our skin tone. And so we talked about I mentioned this before, is that if someone is in the sun, depending on their skin tone, so someone like me who's very light skinned, or in this case, I guess the clinical definition is fair skinned, if I was there for 10 minutes, I would get about 10,000 international units of vitamin A. Whereas if I was a dark-skinned person, so that's more defined as an African-American with very dark skin, they would actually, for that same amount, or, would need to get to be out there 2 hours longer. Okay, so that's 6 times longer for someone who has darker skin. So if we're talking about the population in Fresno, are there more people with light skin or dark skin living here? So the diversity of the area that we have, we need to take into consideration. We might have more people that are not getting vitamin D at the adequate amounts, because who has 2 hours to just be out in the sun? And when we're talking about exposure, we're talking about our head, we're talking about our shoulders, like being able to see our shoulders down, and then right above your knees. And so if you're out for that long, again, I can be out for 10 minutes like that, but an African-American dark-skinned person would need 2 hours. So, if you're somewhere in between there on your skin tones, then maybe we're not getting enough from the sun. And if you go back and look at your diet and your diet didn't get very much, then I want you to be worried about it a little bit. How are you going to increase that? What can you do? So let's look at some of the foods. So when we look at this, how much does our body need right here? These are the amounts. And actually we had to just increase the children a couple years ago because we were starting to see rickets redeveloping again. And so we decided that, well, I say we, I wasn't, it's the brainiacs, right? Remember, they get together and the scientists and they argue about these things. And so they looked at vitamin D and they looked at the intakes maybe need to be increased for children so that we get less rickets. But can you get rickets as adults? Absolutely. We just don't call it rickets. We call it osteomalacia, but it's the same thing. Okay, now here, looking at this, these are some of the foods that might have it. So as you can see, if we're looking at this, these aren't fruits and vegetables, folks. So this one, you have an opportunity, if you don't like fruits and vegetables, to give vitamin D in your diet, except if you're also omitting this macronutrient protein. So for those of you that might be vegan, it might be a little bit harder, because if you start to look at these things, these are, animal-based products. And so that might also be problematic. So we also know that vegans tend to have a lower amount of vitamin D in their diet. But what can they do? They can get it from the sun, as long as, again, that they have the time that's necessary. Now, the other thing that I didn't mention to you is that when we look at vitamin D, it does matter where you live, meaning that we are lucky in Fresno as far as our latitude and our longitude of where it is in the United States and where we plot on that, globe, because there's a thing about how much sun exposure, and we actually get enough sun exposure all year round, where some places like, let's say, Fargo, North Dakota, Fargo doesn't get the sun as much as we do because they're at a different latitude and longitude than we are. And so they don't get the sun exposure like we do 365 days a year. So we're lucky, but at the same token, are we unlucky? Because Fresno also has really high what? What else are you thinking about when we think about the negative part about Fresno and sunshine? We have higher rates of pollution. So is there a pollutant layer that's getting involved between the sun and us? And is that problematic? And then secondly, even in addition to that, Could there be other problems? Are people putting a lot of sunscreen on? Yes, the dermatologists are telling everybody, if you go out, go in the sun, you need to wear sunscreen. And so dietitians and dermatologists tend to go head to head. But then the other part of that too is the color of our skin. And if we have more darker people here, and we also have fog, if we don't have global warming going on and we actually have foggy seasons, then when the sun, we don't see the sun 365 days a year. So, you know, keep all that in mind. So it is the sunshine vitamin, but that might mean that we need to get it in our diet if we're not getting it from the sun. Okay, oops, I went to the wrong thing. Okay, so vitamin D toxicity and or deficiency. So what do we know from toxicity? What can be problematic? Yes. So again, it's a fat soluble. So most of our fat soluble vitamins are going to have toxicity levels. And so what this one happens is it's something called hypercalcemia. So again, calcium, right? That sounds like calcium. Hyper's high, and then emia is in the blood. So what is this? It's causing damage to calcium deposits that are in the kidneys, blood vessels, and heart. So if I get too much vitamin D, those are going to be some of the things. And so calcium can stop the heart. You know, I mean, it's big that way, right? So we don't want to have too much of that, right? So it can also cause the nervous system and severe depression. So too high levels, though, are rare. And they are rarely caused by food intakes or overexposure to the sun. Because I was thinking, as I'm saying all this about the sun, and people are thinking about this, you know, what if I worked at like the Island Water Park all year, and I'm out in the sun and I'm getting all the sun? It's not going to happen from that, and it usually doesn't happen from food. So how is it happening? Again, supplements that are not regulated by the FDA, and people don't know how much to take. They don't know how much they need, and they take too much, and then they can have problems. Now, what are the problems of a deficiency, which is actually what I think more of you are probably going to be having an issue with, as far as when you look at your diet, you're not going to have too much vitamin D. You're probably not going to have enough. And so that means rickets, right? And we've talked plenty about that. So that's the bow-leggedness. Now, if you're older, it's just the adult equivalent of rickets. Like I mentioned before, it's called osteomalacia. And then of course, the other one that goes along with that is osteoporosis. And so no one wants that, because that's where the conditions in the bones, where everything's demineralized and there's no bone structure there, and they just collapse, right? So no one wants osteoporosis. Okay, so here's just some clinical examples of this. And so this is rickets right here. And this is the one that's in your textbook, and it just shows that bow-leggedness of the baby, where that's not, where the bone formation hasn't happened properly because that, but here are two that I took, and of course my son tells me that I should not have taken these because I didn't ask these folks permission first, but I'm only using them for the context of this course. And so this is actually out in the Villaggio side of Fresno, but this just gentleman was standing there and he was talking to this woman, and I just want you to see this. Like, I was showing that to my child, and I was saying that that was osteomalacia. That is a bow-leggedness. And then here I'm in the airport, and the gentleman, so I was not taking a butt shot. Although what I was trying to get again is this fact that this gentleman was had osteomalacia and was bow-legged, and it was most likely due to his vitamin D levels. And I so wanted to ask him about it, but of course that would not be appropriate, and I did not. But it was also inappropriate to take the photos, so my bad on that. Okay, vitamin E. It's also called, the clinical name is called alpha tocopherol. So by the way, if something is actually fortified with vitamin E, they're not allowed from the FDA's perspective to put vitamin E, because that's not their clinical name. So if you see something on the label and it says alpha tocopherol in the ingredient list, it's just a vitamin that's being added to it. And in this case, it's vitamin E. So what do we need to know about vitamin E? So again, it's a fat soluble vitamin. It's going to be stored in our fat cells, and what does that mean? Obviously, it's going to mean if I take in too much, can it be problematic? Yes. But what does it actually do for me? So how good is vitamin E? And this is where I want you to understand that vitamin E is probably one of the ones that gets the most media publicity, because it is a really good antioxidant, right? So here it says right here, powerful antioxidant. So people take vitamin E to help them with their free radical formation, and specifically the one that's been really, really good with is the #1 killer among Americans, which is heart disease and this LDL problem that we've had. Remember the LDL, the lousy, the lipid that you want to have lower? So this one is preventing the oxidation of the LDL cholesterol. So it's actually helping people have less of that lousy cholesterol, and that's a good thing, right? and people want that. So having a diet that's high in vitamin E can help your LDLs. Okay, not your HDLs. Remember, there's only 2 ways to help your HDLs. You guys remember? We talked about it. Dig deep in your brain. Is it exercise? Yeah, exercise is one, and then fiber is the other. Okay. All right, back to vitamin E. So how much do I need and where do I find it? So here's my food chart that's going to show me some of the things that I need. So 15 milligrams of alpha tocopherol or vitamin E. So the upper tolerable intake limit before it becomes toxic is 1,000. So if you look at that milligrams, so there's a big disparity there. So good news on this one is that not as many people tend to overdo it on this one, just based off of that. But you can't really overdo it with foods. It's not toxic in these, so I could eat as much spinach as I wanted to. I could eat spinach and spinach and spinach, and it is not going to be a problem. Okay. However, it could be a problem if I take a supplement. Okay, vitamin E toxicity. So again, not from natural sources, but where we get it is from people that take supplements. The other thing though that can happen is that it can be in fortified. They can fortify it into foods. And so a lot of times because manufacturers have realized that, hey, people know about vitamin E being an antioxidant, I'm gonna go ahead and fortify it in my product. I'm just gonna go ahead and bring it in, and then I can claim, you know, good things, right? But then if it's fortified in the synthetic form, it can be a little bit problematic as well. So we want to be careful of that because it has an increased risk of hemorrhage. So what is hemorrhage? Like bleeding out, right? And so we don't want people to take in too much and then have it actually, you know, have a problem where they're hemorrhaging or, you know, have excess bleeding. Now, deficiency in this one is rare. And that's typically also because guess what? We fortify it in a lot of things because it is important to have, and we know that we have to have it, but we don't really have to have that much. So it's not usually one in which people are low in, and then same thing to get to that toxicity level, it's really high. Now, one thing I did want to back up, I had totally neglected to talk to you about when we were at the vitamin A, and that was that vitamin A, you could eat as much vitamin A foods as you want, and you're not going to get toxic from it. Remember I said that you could eat all the carrots and turn orange. But one thing that I did want to point out here is that there is one thing that is above the upper tolerable intake limit, and that is for the folks that actually eat liver. So if you know someone who does eat liver, you know, liver, like when we look at our liver and what it does is it's detoxifier. And so it's got a lot more toxins in that particular area. But one of the things it also has a ton of is vitamin A. So if you take in a lot of liver, then you need to be careful because this is the amount you need for the day, and this is your toxicity level right here, and so this is excess. So be careful if you're eating a lot of liver or you know someone who likes to eat a lot of liver. So sorry, I forgot to say that, but again, most people don't eat a lot of liver, but it's something everybody should know about for the exam. Okay. All right. Oh my gosh, I'm talking so fast, I'm out of breath. But here we go with vitamin K. Okay, so it's the last one that we're talking about of the fat-soluble vitamins. And what is vitamin K good for? So this is the one most people know is actually good for blood clotting. So if we have someone who gets a cut and their cut keeps bleeding and pending, it's not like this huge deep wound that they need to go to the doctor. What does that tell us? It tells us that they might not have enough vitamin K in their diet. So this is the stuff that helps us really clot. Okay, and so it can be helpful for that. It's also really good for the bacteria in our colon. You remember our colon? We love to talk about fiber and this undigested portion that goes to our colon. And so how important to have that really good bacteria or gut bacteria in our colon. And vitamin K is very helpful for that, which is one of the reasons why we actually do give it to babies right away after they're born, because their intestinal tract is so young and so brand new, and we're trying to get it built up really fast. And one of the things that it doesn't have a lot of is this good bacteria that vitamin K provides. So we actually give babies vitamin K. Now, they typically will give vitamin K in the form of an injection to babies. So keep that in mind if you didn't want your baby to get poked, that there is also another way in which you can do that, and it's at a compounding pharmacy where it's ground up and you can give it via liquid, right? So of course that's what I wanted to do for my baby, but of course when I did that, it threw everybody off because Kaiser wasn't ready for alternative people like me to want to do something different. And so anyways, it was quite a challenge to get the vitamin K from a compounded form from Kaiser's pharmacy. However, I can also tell you, if you're a Kaiser patient, that it should be a lot easier now that they've had me as a patient, so they know what they're doing now. But it was a process. Okay, vitamin K, what do we got? So men need 120 micrograms and women need 90 micrograms a day. So Whoa, do you see this? Look at this. All these green vegetables, right? Or all these this green area, because guess where we get the most vitamin K from? Vegetables. It's not from fruits. Huh. So this is where it is still really good for you to eat some vegetables, right? And so the good news, at least for me, is looking at most of the time I can find people and they like broccoli. So they're willing to eat that. But, you know, kale is on here. Brussels sprouts are on here. Romaine lettuce is even on here. So if you're going to have a salad, I'm all for that. And then with your salad, if you put a little olive oil on it, like some Italian dressing that you've made from scratch, right? Because remember I told you how to do it really, or at least buy the one that's separated and then dump off a bunch of the oil, but you get a little oil. Hey, you're good to go, right? So vitamin K is important, and we want to get more in our diet. But the other thing I want to look at is, can it become toxic? So that's the other part when we look at this, is that there are times in which we need to get a little careful with this. But so toxicity is the only time that I get really worried is that if we have someone who's taking an anticoagulant. So again, for my nursing majors, this is kind of interesting for you, especially if you're working on the floors and if you're working with someone who's taking an anticoagulant medication. What is that? Do any of my nursing majors know? Is anything coming to your mind on which drug that might be that's an anticoagulant? Why would you give that to someone? Probably if they've had a stroke, right? So we're trying to we don't want coagulation happening. And so in this case, if they've had a stroke, which is also, again, in the top 10 killers of Americans, so you're gonna see a lot of these patients on the hospital floors and they're gonna be started on something called Coumadin or warfarin, generic brand. Okay, so when we look at that, what's happening there is that this anticoagulation medication is doing its job, but then I give them a salad with a bunch of kale and a bunch of romaine lettuce because they just had a stroke and they're trying to eat healthier and they want to do better. Actually, it's the one time I'm going to say, don't do it. It's okay. We tell people when they start on this medication to not have an increase in these dark green leafy vegetables. Okay. So, but other than that, I'm not really worried about people having toxicity problems. Okay. Now, I do think more people have deficiencies, although again, it's not a big deal. There's not that many of them, but what happens typically with infants that are born with too little vitamin K is though the infants that or there's two things that happen and why we give it. First, it's the gut, like I spoke about. And then secondly, also because some babies, you know, have a traumatic, you know, birthing process into this world and they can have a hemorrhage, you know, if their head was knocked or moved or suctioned or things like that. And so we don't want to have them have this bleed out, right? And so we don't want them to have a hemorrhage. And so the vitamin K, because it's an anticoagulant in the sense of it's helping stop and not have that bleed out, we want to have that process happening. And so that's, again, why we give the vitamin K. But if they could bleed out and that could be a deficiency problem if they don't get enough. Okay. All right. So I guess I'm starting wanting you to think about, are vitamins necessary in a form of a supplement for good health? And what are your thoughts on that after kind of hearing some of this? Am I slanted one way or the other? One of the things that dietitians say a lot is food first, supplement second, right? And so yes, there's going to be a time in which supplementation is warranted, hopefully. And so you're thinking about this in that perspective. And then of course I said it's not regulated by the FDA. So are there any ways in which you can actually choose supplements that could be better than others? So at least I want you to be thinking about that. So of course, this is what the science is saying. So, you know, not trying to put my opinion in there, although I just did. This is what we want to say, is that there's no evidence that supports the use of supplements for preventing chronic diseases or cognitive decline. But we do have a lot of science that says healthy eating can do those things. And so, you know, just keep that in mind. But I also think that we're going to start to see more of this. One of the things that we're seeing is this thing, it's an antioxidant or phytochemical called resveratrol, and it's been very, very good. It's a tannin that's kind of in wine, and it's one of the reasons why you hear that people that have a glass of wine don't have heart attacks, right? And so now they're starting to put this resveratrol in a supplementation format and giving it to patients and seeing if they have a better outcome than they do from the standard lipid-lowering medicines that we have. And you know what? It's pretty favorable. So, you know, is this going to change a little bit? Probably so. But for now, now what I'm going to say is food first and supplement second. And of course, if people can't get the food, if they can't get it in their diet or they're not willing to, then maybe they need a supplement. So what do you need to know about choosing them? So this is what I want everybody to know is there's this thing called the USP. So in the United States, you can get this seal. So it's a company that has the vitamin actually has to pay this company to come in and test their product to ensure that whatever they say is on the label of their product is actually in their product. The active ingredients is the right amount and all of those things. So it's almost like, if for like the nursing majors, it's the JCO of the hospital. It's the people that are, you know, going to keep you up to your clinical standards that you're saying that are on the label, because they're not regulated by the FDA and there isn't anybody doing that. So if you see the USP label, then you know that this company is paid extra to have their product scrutinized by an outside auditor that comes in and looks at their product. So that's good. What will also happen though with that is that if a company does that, of course, they're not going to just do that on their own auspices because it costs them more. So of course they're going to up the price of their particular supplement at 9 times out of 10. So it's also going to be the one that costs more. So, you know, keep that in mind. But there are some companies out there that that are probably not reputable, and people need to be aware of that. And these companies that have this label are a little bit more careful. Okay, so what I'm going to do, here it is. This is the actual label for you right there. Is now we're going to talk a little bit about who might benefit from a supplement. And so we definitely know that pregnant and lactating women actually need more, especially because they have morning sickness and they're building a baby and they have higher needs. And so it's important for us to give them a supplement. We also know that older people, as they get older, have a real problem with vitamin B12 absorption, as well as our vegans. So in that case, we definitely probably are going to be giving them supplementation for that. Remember the people that I talked about that have low vitamin D and or sun exposure, they might need a supplement. Individuals that are on very low calorie diets, if someone's on a low calorie diet, very low, or what we call a low calorie, is anywhere between 1,200 calories or less. So anybody that can't really meet that recommendation with food, you can't get all the food groups and all the foods that you need at 1,200 calories a day. So they probably need a supplement at that point. If we have someone who's, you know, very strict vegetarian or vegan, sometimes we need to supplement, and that's okay. Especially if we have people that have food allergies or lactose intolerant. We've talked about a lot of the different populations that have lactose intolerant, and so how important it is for us to get calcium in their diet, and we may need to supplement in that case. Also, people that abuse alcohol. First of all, that we're going to get into when we look at these B vitamins, a couple of the B vitamins that can be problematic from a metabolism perspective, and if they use a lot of alcohol, they counteract each other. Secondly, just as an alcoholic, they're taking out their macronutrients and putting alcohol, which does have calories, in its place, then you're going to have less of your macronutrient intake, and so therefore you can, you know, have less of fruits and vegetables and those kinds of things in your diet. Okay, individuals who are food insecure might need a vitamin supplement. So it's also something I keep telling people is that, you know, we need to have some people donating supplements to the food banks as well, because these people would benefit from some of that, especially because, you know, if they get product that's not native to their diet from a food bank and they don't know what to do with it and they don't use it, then, you know, they're not getting it. And then breastfed infants definitely need some supplementation for some of the, especially vitamin D. Okay, so that is all I have for this one, but guess what? We're not fully done, even though, man, that was a long lecture. I need to get in the water soluble in real fast. So I say real fast. Okay, let's see. We're going to bring this one up and bring it over. Let me start it from there. Move that back. Okay, so hopefully you guys can see it now. I'm not doing I click a reef. Okay, what is a water soluble? Remember I had mentioned there was 9 of them. Okay, so there are 8 of the B complex vitamins and then vitamin C. So that's kind of how you're going to know that one. But here they are right here: thiamine, riboflavin, niacin, vitamin B6, folate, B12, pantothenic acid, and biotin. For the purposes of the exam, you do need to know all of these, but I don't spend a lot of time on pantothenic acid and biotin because those ones theoretically haven't had as much benefit to our body, but we still need them. It's just like, ask a hairdresser. They love biotin, right? What does it say? Because it's good for growth of your nails and your hair. So it's not to say that they're not important. It's just when we look at the diet, it's not so much as an important factor as some of these other ones are. So we're going to spend more time, and then I'm only going to lecture on those ones. So one of the things that's different about these than, say, the fat-soluble vitamins, besides the fact that they're water-soluble, which means, of course, we just excrete them out of our body. They're not stored in our body. So if we take in most of these and we take them in too much, it's less likely that they're going to be toxic because I'm just going to pee them out. I'm just going to have really expensive urine and extra vitamins in my urine. But the other thing that's different about these is that they're easily destroyed by heat, light, and oxidation. So when we do actually talk about cooking some of these products, then we might actually be decreasing the vitamin or nutrient content in these particular vitamins. So keep that in mind. All right, so here are this compare and contrast that I was telling you about early on in the lecture, is that I do want you to know, so this is a really good slide for you to keep and revert back to as far as where they're absorbed, where they're stored, if they can be toxic, and if they need to be consumed daily. Because again, like with fat-soluble vitamins, if they're gonna stay in my fat, and I don't get that particular, if I don't get vitamin A today, but I get it tomorrow, am I okay? Yeah, because it's in my fat, it's stored there. The body can pull it out and utilize it if it needs to. Whereas a water soluble, if I don't get it today, I needed it and then I peed it out, right? Or I didn't get enough of it. And so then the next day I need to get it again, right? It's not going to stay in my body. So it can be a little bit more important for people that don't have a good vitamin and mineral content when they look at their diet analysis to be concerned if they're the ones that they are having problems with are any of the water soluble vitamins. Okay, so here's just the functions of them. Pretty much what we can say here is that all of these ones right here, when we start to look at these ones, which is quite a bit of them, help with the product transformation of our macronutrients. So the carbohydrate, protein, and fat to form ATP and metabolism. So all of these are important in that particular process. So if there's one and it's asking you what the function is for the exam and you don't know it, it's just good to just guess ATP, right? Because that's with so many of them. But they do have other things. Remember here when we looked at the metabolism chapter, you can kind of see how these kind of play in. But right now, what I want to go over is vitamin B1, which is thiamine. So thiamine was the first B vitamin that was discovered. It was discovered in 1911. That's a little bit more just like factual information for people to know. But what is it important for is really what I want you to know. And so its absorption as far as that goes is in the jejunum. And I point this out because if any of you are nursing majors or dietetic majors like I am, if you have a person that's in the hospital and they've had some kind of procedure in which they've, cut their gut out or portions of their gut, if they had short bowel or, something where they had a bowel obstruction and cancer and things and they were chopping and taking things out, did they take out the jejunum? Because that's where this is absorbed. So that's why I kind of want to know that. And it's absorbed by passive diffusion, which again, we're not getting into the active and passive and all of that, but it's kind of nice to know that. Active transport, we did talk about also in metabolism. So it's used with low intake. So sometimes it can actually be used if our intakes of it are low as active transport rather than passive diffusion. And it's transported through the blood and excreted in the urine, which most of you can figure out because it's a water soluble. This is all how it's working with ATP production. So I'm going to skip that because again, I'm wanting you to understand that a little bit, but I really want you all to understand how much do I need and the food sources in case you are low. What are some things that you are willing to eat that are on these lists that you might like to try? And so the good news is that we tend to enriched and fortified this in everything. So most people are not going to be low in this because as you looked here, most people are eating some of these things like bread, rice, oatmeal, peas, okay, like not chips, but pretzels, things like that. We're getting them in our diet, right? So we don't need to be so worried probably from a low perspective, but I do want you to know kind of where you can get it. And then can it be problematic where I had too much? So there is no known toxicity for this, okay? So that's good, but there are going to be times in which I do see this as a deficiency because it's a water soluble. So we definitely see more deficiencies in the water soluble because they're needed daily, right? And so there's something called beriberi, and you can either have wet beriberi or dry beriberi, but it's something that will happen, and You will have a loss of appetite when you have this. You'll have weight loss, confusion, muscle weakness, and peripheral neuropathy. So unfortunately, though, that's a lot of symptoms for a lot of other things too. And so it's kind of hard to diagnose, but we usually get to being able to figure it out in the hospital setting and are able to fix it. Okay, but this one is a little bit harder to fix because it's called Wernicke's-Korsakoff syndrome, and it is caused by chronic alcohol use. And so again, what happens is in this process is that this particular thiamine is needed, but when you drink a boatload of alcohol, it actually doesn't allow the thiamine, even if you were having some, to actually do its job. And so that can be problematic for people. So we tend to see this a lot as far as deficiency. If I'm going to see someone with a thiamine deficiency, it's usually someone who is a chronic alcoholic. Okay, oops, am I supposed to add that in? Okay, all right. Causes of deficiency: inadequate dietary intake, malabsorption, alcoholism, prolonged diarrhea, and times of increased need with too little intake. So we've had it where we are building a baby and someone has like severe nausea and vomiting really bad and just has very poor dietary intake, and they're like pregnant and lactating. We also, with malabsorption, can see it where if we've got someone who has their bowel, again, chopped on and the jejunum's out and things like that are happening, or someone with C. diff. So we've talked a little bit about that before in the hospitals and how contagious C. diff is, and that it gives someone who has this bacterial infection where they have a lot of diarrhea. And so that's another reason why if we have someone with C. diff that we want to check their thiamine deficiency as well, because it just, it's running through them and it's not going through the absorption process. Okay, B2, riboflavin. So what is it? Okay, so here's a good bolded one for you. Stable during cooking, except in the presence of ultraviolet light. So this is one. So guess what? There is something that you probably have, well, some of you might have in your refrigerator right now that has B2 in it, which is the riboflavin. So it's in the refrigerator and it's a white substance and it's a liquid. Guess where I'm going with that, right? It's milk. So one of the things that, I don't know if you've ever noticed as to why milk is in a carton, or if it's in like that opaque type of plastic container that we use. The reason for that is actually, I don't know if people can remember, but at some point there was this thing called the milkman. And the milkman used to drive around and he would deliver milk to everybody's house. And they were in glass and they would set them outside on the porch. But one of the things that we found when all this happened is that the riboflavin, as they sat out on people's porches and were exposed to sunlight, lost the riboflavin, and we actually had a lot of people with deficiency during this time. So this is one of the reasons now why our containers for milk are back into a carton, that they don't see the light, or that opaqueness helps filter the light. So kind of an interesting little side note. Now, I don't know, I do like Rose's milk, but I'm not sure why they package it other than they want it to look old school like that. I'm not sure about the riboflavin in their milk because it might be getting too much exposure, but I don't know that for a fact. So don't stop buying it just for me saying that, but do know that there's a reason why we've changed the packaging for milk. Now, what is the function here as far as absorption? It's attached to proteins. It's released in the presence of the hydrochloric acid in the stomach, and it is absorbed by active transport in the small intestine. So again, if someone's had issues of their small intestine taken out, then maybe they might be a candidate for someone who might have a deficiency in riboflavin as well. So it's something that I need to think about. This is from the metabolic function, which again, I've just told you, just choose metabolism if you don't know. This is the stuff I really want you to know, is how much your body needs and where you could find it. So when we start to look at this one, what are you noticing here? Major sources: milk, yogurt. So if we have someone who's lactose intolerant, they're probably going to have less riboflavin just because they're not eating these types of things, although some people with lactose intolerant can tolerate yogurt. But the good news is that we enrich it and they fortify it into a lot of grain products. So if we have someone who's doing a lot of grains, but again, I want you to just think for a minute. The people that we're talking about who wanted to go gluten-free but don't really have any problem, they're not true celiac patients that don't, they can tolerate gluten. So if we start to cut gluten out, where is gluten found? It's found in a lot of grains and cereals. So if you cut that out and you're lactose intolerant, Now we might even have an issue with being low in riboflavin. So, just keep this in mind. When we start to cut a macronutrient out like that, which would be kind of carbohydrate in the sense for the gluten, then we start bringing on deficiencies. And so we get nervous. As dietitians, I get nervous. But these are some of the ways in which you can find them in your diet. I have a feeling most of you were fine on your riboflavin, or we weren't that low. You might have been a little low, but not that low. Okay, but if you are having a deficiency, this is what it looks like. So you can actually get, this is called chelosis, and then this is called glossitis. So this is just, when we start to look at this clinically, you see how we're looking at this side is very shiny, where this side is not. Okay, so it's usually inflamed and red, and it will have this kind of glistening to it. So these are the things that as a dietitian, we actually ask patients when we do their physical exam, we ask them to stick their tongue out so that we can look for those things. Okay. Skip one. All right, niacin. All right, so niacin. So this is the one that I get most worried about from people actually having toxicity on the B side of vitamins. And that is because niacin has been very helpful at combating something that happens to be the #1 killer among Americans. So again, if you have something that's the #1 killer among Americans and people start to realize how important niacin is, you might have people going out and taking too much niacin. So keep that in mind, that in this particular case of niacin, the things that it's good for is that we do know that if we can get it in the right amount, that it can lower your total cholesterol. So this lowers your triglycerides that are high and actually can raise the HDLs. Remember I told you there's only 2 things? So niacin can really help with that product, but niacin typically is going to go along with fiber and travel together in whatever the food item is, and that's why it's helpful. But either way, these are going to be reasons as to why people might try doing this and might try doing it on their own. And when I say on their own, what typically can happen with this one is that it can get really high really fast. And so when we look at this, what is actually needed for niacin? And then the other thing is that there are certain things that can be synthesized from niacin. So if we have tryptophan, you remember tryptophan, it's an amino acid. And so if you have tryptophan, it can also lead to niacin as well, just from the conversion factors. So can we get too much of it? Possibly. And so from our food, no. Okay, not problematic from the food, but definitely problematic from a supplementation. So the upper tolerable intake limit here is 35. So you see here that all we did, if we double it, then we are at our upper tolerable intake limit. So it happens pretty fast, okay? And so that's where we get nervous. The other thing that I've seen is that the clinical trials that are showing the niacin, that we actually have to get very close to the upper tolerable intake limits to get the benefit that people need. And so we're kind of like flirting with problems at that point, because these are the things that happen if you have toxicity. So when we look at this, we're talking about reddish colored in the face, so very flushing in the face, nausea and vomiting. You might even get heartburn. Your liver becomes toxic, so we do like liver tests, liver function tests. We'll start to see, very elevated liver function. And then we're going to have raised blood glucose levels. But this is painful. Like when you see this hurts. Like, have you ever been embarrassed, and then like you got embarrassed and you like turn red, right? But then it goes away after a few minutes. Just imagine staying flushed like that for long periods of time. It's like women going through menopause. It's not fun. This gets very uncomfortable. So this niacin flushing is what this is called. Okay, now, if you have a toxicity though, this is the different side. This is gonna be more like, I didn't get enough, that it's called the 4 Ds, okay? And it's dermatitis, it is diarrhea, dementia, where you don't know what's up, and death. Okay, so usually we catch it by the time they get to the dementia stage, but it can happen. So, we can have a problem with a deficiency. Again, it's called pellagra for the purposes of the exam. Okay, B6. What is B6? So when we look at these things, there's things that I want you to know about B6 and B12 and things like that. Like, what are they doing? Again, this is happening when we look at this. It's the amino acid conversion. This is happening for metabolism, right? So it helps with carbohydrate metabolism. So if we look at this whole thing from glycogenolysis to gluconeogenesis, remember that? Gluconeogenesis, what is that one? Neo is new, genesis is the process of this is the glucagon, right, or gluco. So it's converting new glucose from non-carbohydrate sources. So we're going to need this to do both of these things. So if we want to store glucose or we want to convert it back, we need to have vitamin B6. So it's important. It also makes hemoglobin for red blood cells. Oh, guess what? Oxygen, that's important for us. So it actually can reduce the risk for heart disease, which is the #1 killer among Americans, and it also can reduce nausea and vomiting. So we actually give this to pregnant women sometimes who are still having nausea and vomiting or having a real problem with nausea and vomiting. This might be something that we offer to them as well. Also, when people are really upset, I've had friends or family members that have like had a death in the family and they're crying and then they're like, I can't eat. I don't want to eat, I'm very nauseated. Sometimes I might suggest some B6. Again, food first, supplement second. But on this one, we don't really typically have a whole lot of problems. The amount is small. So they're in milligrams, 1.3 to 1.7 or 1.3 to 1.5. The upper tolerable intake limit is 100 milligrams. So again, big difference in the amount. So it doesn't tend to cause toxicity levels. And it is found in a variety of foods. And you see this one here, ready to eat cereals. Most people eat cereals. It's fortified into the cereal. And so therefore, it's not one that people tend to have deficiencies from. So toxicity though can reach toxicity levels usually due to intake of supplements. So again, not food. It's nerve damage, difficult walking, and tingling in the legs and feet. So again, there are some people that have tingling in legs and the feet. And so one thing I always try to do if they're complaining of that is that make sure they don't have, that they're not taking a boatload of B6 or something like that, or getting it somewhere, or just eating, Special K 5 times a day. I have elderly patients that just eat cereal because it's easy. So sometimes I have to, look for these things. Okay, so deficiencies of this one though, you'd have a sore tongue, inflammation of the skin, depression, and confusion. And there's something called microcytic hypochromic anemia. So this is where we're talking anemia is the blood. Micro is very small. And so it's this part of the red blood cell that are really small and they're pale and they're not strong and they can't do their job that they need to do. And it's often caused by excessive alcohol consumption. So here's another one. So you remember Warner-Nichols-Korsakoff syndrome? Now we're actually looking at this one as well, as far as B6 as being a deficiency. So if I have one, I probably have the other. Now, what's interesting about B6 and folate too is that they also tend to go hand in hand, and sometimes they can mask each other on a deficiency, but hold that thought. So what is folate? Okay, folate is found in foods, okay? Folic acid is the synthetic form. It is not found in foods unless it's added as a fortification. So this is one thing that's different that I want to point out is that this is weird because we always say food first, supplement second, and that the food is usually always more easily absorbed by the body and is taken in better and absorbed and goes through its process always better. This is the one exception that doesn't happen, and that's folic acid. The synthetic form is actually absorbed better than folate itself. So that's kind of interesting, but it's also why we give women who are pregnant supplements that have folic acid rather than folate in them, okay? So here when we look at this, what is it good for? The definite thing that I think most people know that folate is good for is, this is just, look here. Oh yeah. Okay. But here's what it is. It's neural tube defects. Okay. So this is called spina bifida, where the spine is actually developed on the outside of the body. So unfortunately what happened in this particular case is that mom was pregnant, did not probably know she was pregnant, or she did not get she wasn't taking prenatal vitamins. For some reason, she did not get the amount of folic acid that she needed, or folate, in her diet. And therefore the baby was born with spina bifida. So this is a big deal. And the reason why I say this is that when we start to look at this is that when we look at folic acid and when we look at the spine of a child, you haven't got to our pregnancy chapter, but you probably will be getting to it very soon. We're going to learn that the spine is developed in the first 4 weeks of life. So when you start to think about it, the first 4 weeks of life, the spine is already actually formed. Well, when do women typically find out they're pregnant? Unless they're really trying, probably not before 4 weeks. So it's important that women of childbearing years, whether they're trying to get pregnant or not, get folate. So again, if any of you are women and you have your diet analysis and you go through your diet analysis and your folate levels shows that you are low, I want you to be concerned. The reason why I want you to be concerned is, you know, sometimes oopsies happen, okay? So we don't want anybody to have an oopsie that ends up with a baby that has spina bifida. So it's very important to get folic acid into your diet if you are a woman of childbearing years. And if you're a male, it's important for you to know if you have a female partner, you need to be telling her this, okay? So again, looking at this, it's important to get because we don't want to have that. Now, good news is, though, is that it is found in beans, legumes, and cabbage. Most of you aren't eating cabbage, but some of you might be eating beans if you can find them right now, or legumes. So keep that in mind. And then folate is destroyed with the exposure of heat and sunlight. So depending on how you cook it, sometimes the beans, if we overcook them, can be problematic. Okay. So here's just some of the metabolic functions. I had already kind of mentioned to you the neural tube defects and encephaly, which is just, you know, the same kind of thing happening, but it's happening to the brain area, spina bifida. So, and folic acid can actually help prevent, or folate can help prevent cancer and heart disease. Are those the #1 killers among Americans? Gee, so if you're a male, you still need to worry about folate from these perspectives as well later on in life. And so the reality of it is that we are not getting enough folate. So go back and look at your folate amount. Have a feeling it's probably low. So how are you going to get more of it? So that's what I want you to figure out is how much do I need? Here's your recommended dietary allowances of that. And how are you getting it? So 400 micrograms for women. Is what we're talking about. And then we also, when we talk about women of childbearing years, so pretty much that's anybody who has menses until, you know, they've had menopause. These are the people that need to be getting 400 micrograms a day, as well as males. And then if you're pregnant or become pregnant, you want to have a diet where you have 400 micrograms plus a diet high in natural folate. So we typically tell women 400, and then we'll give them a prenatal vitamin that has some of it, but we still want them to get natural folate as well. So we probably will give it their folate supplement that they have, will actually give them 400. So that puts them at 800. So that puts them very close to this upper tolerable intake limit. But again, if they're doing a diet high in natural folate, it's not going to be toxic, okay? Because it's the natural folate. That's not a problem. It's only the synthetic form, which is the folic acid that's supplemented into products. So major sources of folate, not folic acid, are dark green leafy vegetables, legumes, and seeds, enriched pasta. So if it's enriched pasta, now guess what? It makes it folic acid. Rice, breads, and cereals, and then of course liver. But again, most people aren't eating liver. Okay, so here you can take a look at the amount that we need and then where we stack up and where you might be able to get some folic acid or folate in your diet, specifically if you were low and are a woman of childbearing years, because that could affect you now. Okay, so toxicity, no risk from eating foods with folate, but that's folate, not folic acid. So the dark green leafy vegetables that were on this last page here, this is all natural folate. These are not going to be problematic for you at all. So eat as much of this as you want. It is not going to be toxic. If you start taking in excess fortified foods and supplements, that can be problematic. And part of the reason is that it actually can mask a B12 deficiency, which I think is the next one that I'm going to talk about after folate. So toxicity, what's going to happen with this is you get macrocytic anemia. Remember, macro is big, micro was small. So now you have large red blood cells, and the large red blood cells get so big that they're pushing other ones around, and so it becomes problematic. You feel fatigued, you have weakness, you have irritability and shortness of breath. Gosh, who doesn't have that, right? But this, so keep in mind though that this could be something that could be this could be a deficiency that someone has. So if people say they feel tired all the time, this is something that we're going to look at. The other thing is that sometimes when we look at oral contraceptives, so women's birth control pills can also cause them to be at a greater risk for a deficiency in folate or B12. Okay, so here's B12. Cobalamin is the clinical name on this one. It comes from cobalt. Again, not necessary that I feel that you need to go through so much of this, but what I really want you to know is that this one, its function is to activate folate. So you remember how I said they can go hand in hand. In this case, when we look at this, is that it's helping with the breakdown of amino acids and fatty acids. So the other one was looking at carbohydrates, so these ones solved the other two macronutrients. How much does one need? 2.4 micrograms. So now it's getting really small in the amount that we need. And the other thing that I want to tell you is that when you microwave cook, it reduces the active form by about 30 to 40%. So I'm all for convenience, and I'm all for people having, trying to get their meals fast. But just keep in mind, if you microwave a lot of, like, steam your vegetables in a microwave, that you're probably cutting down on some of the availability of that particular vitamin. In this case, it's B12. Okay, look where we find B12 though. Okay, B12 is predominantly found where? In protein. So this is also when we look at our vegan diet that they tend to be lower in as well, just based off of the fact that this is mostly found in animal products or dairy products. And if someone is strict vegan, they're not having either one of these, right? So are there a few things that they can do to get it? So soy milk might give them some B12. It's because they're fortifying it in, okay? So keep in mind, there's going to be something where we might actually have to sacrifice in this one. One thing that Raisin Bran fortifies this in as well. So some of the cereals will actually do it as well. So you can find it in grain products that way. Okay, so there's toxicity, no known toxicity risks, but there is deficiency. So again, this is where I'm more worried about the deficiency than the toxicity in this particular one. And obviously it's with the vegan diets. It's also someone who has malabsorption without adequate hydrochloric acid. The HCl in the stomach to actually break some of that down isn't going to actually yield the absorption of B12. The other thing that's not on here is, it's not necessarily for deficiency, but as you age, you have a harder time absorbing B12. And so I get worried with my elderly patients that they can be deficient in this. But a gastric bypass, remember we talked in weight management about the gastric bypass. And if someone's had a gastric bypass, they're more likely to have a B12. And so we usually at that point have to give them injections, or there's a sublingual tab that we have them put. Sublingual, what does that mean? Sub, above, below the tongue, right? Okay, now vitamin C, we're almost done because remember there was 8 and then the vitamin C. Okay, so here we go with vitamin C. This one's also known as ascorbic acid. So again, on the label, if you see the clinical name, that's how it's going to read. This one is important for absorption. The small intestine, active transport helps. Absorption decreases 50% with intakes greater than 1 milligram. So that's kind of something to think about. It's excreted through the kidneys and is not stored in the body. So again, it's water soluble, leaves the body. So do I need it daily? Absolutely. So good news is that you don't actually need that much. What is it going to help you with? Well, it's going to help be an antioxidant. So it's going to fight against cancer, but it's also going to help with collagen. So if you want to have beautiful skin, then vitamin C is the thing for you. It's also why you start to see some of those creams, those like pro-retinol. The retinol is the vitamin A, but the other thing it has in it is vitamin C. And that's also to help with the skin collagen formation. And then this is the big one, is important for me, for you guys to know, is that iron absorption. It enhances iron absorption. So if I have someone who is low in iron, I want to give them iron and I want to give it to them with a vitamin C source so that it enhances the absorption, so it's stronger. Okay, and specifically in that note, there's different sources of iron. There's heme and there's non-heme. The heme iron is the meat, but the plant-based proteins for iron tend to be not absorbed as well. So guess what? That's when I really want to have a vitamin C source with it. So if you're having a plant-based source for iron in your diet, then you definitely want to make sure that you're having a vitamin C source with it. Okay, so again, functions, we've already kind of talked a little bit about them. I pointed them out earlier. This is definitely one where most people know that this helps with their immune system. It may reduce the body's response to stress. So again, in this particular time when we're dealing with a lot of stress that folks have with COVID, maybe this is not a bad thing, that we want to make sure people get enough vitamin C. It can aid in the conversion of tryptophan and tyrosine to serotonin and norepinephrine. Do you guys remember these at all? We talked about serotonin. It's like the big chemical brain hug that says, I love you, and makes you feel good. So it's important for people to help them feel good. And then of course, this is a stress hormone. It can aid in the synthesis of thyroxine. So again, when we talk about the endocrine system and how important that is, the thyroxine is important. It converts cholesterol to bile. So is that going to be the #1 killer among Americans? Wow. And so I might be able to take some cholesterol and turn it into bile. That's not a bad idea. And it assists with the histamine breakdown. So people with allergies, this might be something they want to think about, is that it actually, if they're going to take an antihistamine or things like that, what is their vitamin C level and are they going to work? Okay, how much do I need? So this is the thing I want everybody to know is that females only need 75 milligrams, adults need 90, but smokers, whether you're female or male, are gonna need additional 35. And I'm assuming that goes with vaping too, although I haven't really looked at the studies, but my guess is yes, because the whole point of the vaping thing is that you're still getting free radical formation, which is what the vitamin C is going after with the antioxidant. Now the upper tolerable intake limit is 2,000 milligrams. So I only need 75 and the upper tolerable intake limit is 2,000. Most people don't go over on this, even when they're taking boatloads of supplements. So here's where you can find it naturally in your diet. Food first, supplement second. Would you be willing to eat one of these things? Do you see here, it's an orange. One medium orange is gonna give me 70. Okay, I can give you two cuties and you have enough for your whole day. 2 cuties is all I'm asking. That's actually 4. 2 cuties is all I'm asking for, okay? To get vitamin C for your entire day. So you can have 1 cutie for breakfast and then have the other one for dessert before you go to bed, and bam, you're done with vitamin C. But if you can't do that, take a look at some of these. But my guess is that you were still low in that. And when I tell you that it only took 2 cuties to reach that, and you were still low when you did your diet analysis, we got some work to do, okay? All right. Now, we do know, though, the people that consume too much, when we say too much, remember, UL is 2,000. So consuming greater than 3,000 can cause nausea, stomach cramps, and diarrhea. So we don't want someone to get scared like in this COVID situation and just be like, oh, I need immunity. I'm going to go take a bunch of vitamin C pills and then get sick. Okay, so keep that in mind. The other thing is that over time, overconsumption can lead to kidney stones. You have to get rid of this stuff. Your body has to take it out. It's a water-soluble vitamin. How is it getting out? It's getting out through your kidneys, okay? And then sometimes it can actually lead to false positive or false negatives on medical tests. Now, I don't know that they're testing it with this COVID thing. So that's also kind of an interesting thing. Are people then scared and taking a bunch of supplements and then are they having more false negatives or false positives? I don't think anybody's looking at that, but I'm just saying, I'm putting it out there. Okay. So what happens though if I have a deficiency? Ooh, look at this guy. Okay, what is this? This is scurvy, right? You've heard of it, right? Because this is how we discovered vitamin C in the first place, right? But so it was the scurvy part. What do you have? You have bleeding gums. You might even have coiled or curly arm hairs. You might have wounds that don't heal. Now, this I've mentioned before because I've talked about people that have decubitus ulcers and pressure ulcers in nursing homes and how vitamin C and zinc can be helpful along with the amino acids that we talked about, glutamine, alanine, some of those. So in this case, the other thing that we will typically prescribe besides that is vitamin C or zinc supplements or some kind of food that has that in it. And then they also get a rash. So this can be prevented with 10 milligrams of vitamin C per day, just 10. So that's why none of you have scurvy, because most of you are getting at least 10. But all I'm asking you to do is get to 75 or 90, depending on your female and male. So how can we do that? Okay. So I think at this point, then I'm going to stop because we're not going to talk choline and we're not going to talk biotin. So we are actually done with this lecture it was pretty long. But what I'm going to do now is go ahead and stop it so that we can start the next one. So I hope this was helpful. If it wasn't helpful and I went too fast, you can rewind it. If it was too long, I apologize. You don't have to use these. Don't watch the other two because they're going to be probably equally in length. Okay. I'll see you guys in the next video if you choose to watch.